Okay, time to bring up the panel. So I have two wonderful panelists. Come on up. I have Kim, who is with the Arthritis Foundation, and Susan, who is a geriatric life care consultant. And what I'm going to do is go ahead and take a seat. I'm going to have them each take a minute or two and tell you a bit about what they do so you understand the experience that they have as they're teaching you about arthritis. So Kim, let me have you go first.
Hello, so nice to see so many faces. My name is Kim Christensen. I oversee the San Diego region of the Arthritis Foundation. So we are a nationwide nonprofit and we have regions all over the country. So I'm lucky enough to be in San Diego. Our goal is to educate. That is the number one, and provide resources. Obviously, we are going to continue to research and find a cure for arthritis, but until that happens, our job is to give support and give resources and programs to allow everyone to continue to say yes. That's kind of one of our slogans, that we are champions of yes. So we want to help break down any barriers that are preventing community members from being able to continue to say yes to the hobbies and the sports and the activities that they like to do. So I hate to say that I'm not going to give you anything groundbreaking today, but there is no magic pill. I don't have a one-stop shop for everyone to get fixed, but hopefully we can give you all some information.
Susan?
Hello. Oh, there it goes. Hi, I'm Susan Rindler. I'm a registered nurse. Been in the medical field since the late 80s. In radiology also. Worked in the hospital, medical, surgical, oncology. And then I moved down here. I got in the senior living centers. And I've been working all the way up to Director of Health Services, creating a safe environment there and a great living in a facility. Now I take all of that from my background and I bring it to you at home. So anything that you need as a RN, someone to help with your manage your health, your safety in your home, if you need to move to a facility, if you need caregivers, if you need a recommendation for something else. I'm basically like a care manager, case manager, you name it. I can be there for you. And it's funny, what you had said, see on the back of my business card, it says, because you don't know what you don't know.
I love that.
So, I go to the home, I'm paid, privately, otherwise I work directly with your physician to make sure that, we get orders for your health, for anything, all your needs. We can push it through Medicare to get it paid for. Whatever insurance you have, we work together as a team. And so today, I look forward to helping you with any questions and some of the questions you're gonna ask us. And from my background and from working with the seniors and the facilities and those at home, whatever we can do to help out, we're there for you.
Wonderful. So quickly before we get started, one of the things that I didn't say for the new people, whoops, thank you, Rick, is that in that main brochure, I have the first inside page has places to jot down a question. So as Kim and Susan are speaking, if you have a question, rather than raising your hand, jot it down. And we'll stop soon enough before 11:30 that you can ask questions of them. And then the other side, you can take some notes. So Kim, I'm going to start with you. I have some general questions. And Susan, if you have anything to add, please do. So the first question I have is, can you explain what arthritis is and the different types of arthritis that people may experience?
Yeah, so arthritis, if we break down the word arthritis, literally means joint inflammation. So that is kind of the umbrella definition of what arthritis is. It's going to be joint inflammation. There are over 100 different types of arthritis. Most commonly, you are going to hear about osteoarthritis, rheumatoid arthritis, gout, and then juvenile arthritis as well.
Right. What are the most common misconceptions about arthritis that you encounter?
Yeah, I think the number one most common one is that it only affects our older community, which is very wrong. We have children as young as 2 that are being diagnosed with different forms of arthritis. Arthritis is also not just caused by aging. It can be caused by damage, whether that was you were in a car accident when you were young, or you were a baseball player and tore your rotator cuff. It's not something that everyone gets. It's not kind of you have to live with it and it just is what it is as we age. I think that's a big misconception as well. And I would say the final one, which science is now coming around to more, but that there is preventative things. There are things you can do to manage arthritis once you get it. It doesn't have to be a progressive disease.
And arthritis affects millions of people worldwide. What are some of the key challenges that people living with arthritis face on a daily basis?
I think because there is this assumption that everyone gets it, along with that is the assumption that you have to live with the pain of it. So people, as I mentioned before, people start saying no to activities. And there's just this idea that, okay, that's part of aging and I have to accept that. So I think that's a big one.
So one of the things that I did when I was putting together this seminar, and I used the word thriving, I decided to break this down into the word thrive. And so the T is going to stand for the truth for managing pain and fatigue. And Susan, as a geriatric life care consultant, what are some of the most effective pain management tools you have seen for older adults living with arthritis?
Well, there's quite a few, and some of them are extremely basic. One is move. It starts from, when you're younger, to keep moving. Those arthritis is in your joint, and those joints have fluid in there, and you need to keep that lubricated and keep it moving. So between increase your fluids, water, I know water seems boring, you can add stuff to it. Getting up and move. There's icing it sometimes. If it's really inflamed, you can ice it. There's other remedies such as acupuncture, acupressure, massage. They have red light therapy. There's CBD oils. And then, of course, the regular, we go to the doctor and we ask for a prescription. And over-the-counter medications for this, I don't really recommend because I ask you to talk to your doctor first. Because he'll know, and if you don't talk to your doctor, then talk to the pharmacist about those over-the-counter medications so they're not interfering with the other medications that you take.
Thank you. When you mentioned move, I think of a lot of times when I'm working, I sit at the desk and I get up and I'm so stiff. So I've been trying to set my phone or remind myself to get up every half an hour or so and move, and what a difference that makes.
Yeah, in fact, we were talking about it. She's got one of the desks where you stand up and she's got like the little treadmill underneath, so.
A treadmill underneath?
So it's just a matter of getting up and move, even if you're just home alone, get up and walk around the inside of the house if you're, if it's raining outside. If it's warm and sunny, what another really great thing is go to the pool. If you have a pool in your facility, get in the pool, and all you have to do is just walking back and forth, or if you get a kickboard, you can hang onto the kickboard and kick back and forth. That's impact exercise that just helps keep moving, and it doesn't hurt either. It's much more comfortable.
And that's why a lot of our gyms might have a pool, and if you have the supplemental insurance, a lot of times those gym memberships are covered. So I go to the Y, and they have aquafit classes, but they're not at the times I can go. So I often will go early and do exactly what you said. Get in there and walk. It's so much easier to get cardio when you're in the pool too. Okay. So Kim, in your experience, what advice do you give people who feel overwhelmed by fatigue during a flare-up, and how can they manage their energy throughout the day?
We recommend pacing. And it's interesting because you say about standing up at a desk too. So most of the time when we think about pacing, we think about breaks and slowing down. But pacing also means consistently moving as well. So let's say that you are going to plant all of your tulips for spring. The rain's gonna hurt that, but besides that, what we would recommend is, okay, let's pace that out. So maybe the first day you're preparing the soil. The second day you're planting the bulbs. The third day you're watering and finishing things up. So really thinking about how we can pace it out. We want to avoid repetitive movements over and over. So when you start to think about an activity, if you're finding that that's going to involve repetitive movements, we're going to recommend that you go ahead and pace that out. The other thing is honoring how you're feeling. Right, there are flare-ups that are going to happen, and that might mean that you take a day or two to rest. Maybe that garden doesn't get planted this week and instead goes next week. I think it's really important, and it goes back to that we don't have to just accept and fight through pain. There can be an end to it, or there can be an ease to it. So it's how do we work with that? How do we work around it and not ignore it? Particularly with arthritis, because should we ignore it and just keep going, it's only going to cause more damage depending on the type you have, or prolong that flare-up that you're experiencing. So our number one is definitely going to be pace yourself.
So what kind of arthritis gets more damage with flare-ups?
Yeah, so there's two main types of arthritis. You're going to have your autoimmune arthritis, so that's going to be rheumatoid arthritis. So that is your body's reaction. Then you're going to hear more commonly of osteoarthritis. So that is where we are experiencing there's been damage to a joint, so now that joint doesn't fit like it's supposed to. That lubrication that we were talking about is now broken down and gone. So now we have bones that are sitting either on each other or off where they're supposed to be. So that is causing pain. So that's something where physical therapy comes in, occupational therapy comes in to give you maybe wrist straps or some sort of support there to help with that. There's a common misconception with osteoarthritis in particular that no matter what, if you get it, it's going to lead to a joint replacement. And that is also not necessarily true. There are ways to recognize osteoarthritis and then stop the progression of it.
Oh, I wish I would have known that 2 hip replacements ago.
Yeah. Sometimes it does have to happen, but it's not an automatic.
So either of you, what role do assistive devices or technology play in managing pain and improving mobility for people with arthritis?
That's what you're hitting on, is that there are devices for your wrists, for your ankles, knees. There's different braces that we can get the doctor to order it for you. They still want, even though you have a brace and it seems like it's against the movement, but sometimes when you have such a flare-up, you don't need to exacerbate that pain. So they have braces. If it's in your knees, hips, feet, there's ankles, it's easier to have braces put on so that when you do go out and have to walk, so then you have support, so you're not overdoing the other parts of the body to try and compensate for that. So that's one of the really big things. And then of course, the more you slow down and you're starting to get wobbly, we really highly recommend start with a cane and move to a walker. I know a lot of people don't like walkers, but it's a safety thing because when you can't be safe on your own 2 feet, you gotta have a little bit of help there. My 94-year-old dad doesn't like it, but I keep telling him, what's worse, falling. So we don't want that. So it's better to use the devices to help keep you safe.
Well, and I look at my mom, when she started using her walker, she didn't like it at first, but now she walks so much more and she walks faster, because she's not afraid of falling. And so she's actually getting more exercise with it than beforehand.
There's two different types of walkers. There's a two-wheel walker and there's a four-wheel walker. So if she's on the four-wheel walker, she will be walking very fast. We always recommend start with a two-wheel walker, and because you'll have to get used to it to train with it and learn how to use it. And the stronger you get, then you go to the four-wheel walker and you can walk around the block and just don't go crazy on it though.
I think too, from a non-medical standpoint, there's a lot of devices that can help as well. One of the things I love is the choppers. People don't let's think about chopping an onion. That's a repetitive movement, particularly if you have arthritis in your hands. So there are devices that can even help with things like that. It's a chopper, you put it under, you hit it a bunch of times and it chops whatever vegetable there is for you. And then there's also the things like buying the pre-chopped vegetables at the grocery store. It can be as simple as that. That's really gonna give you support as well.
Wow, good idea. Hey, Rick, do you want a chopper for your birthday? He does a lot of chopping in our house.
And even as the progression moves on, we do have assistive devices as far as your utensils. So if it's harder to hold your spoon and fork and knife nowadays, they have not only just the assistive, the bigger handle, things like that, but they can also attach around your wrist. So instead of, if your hand gets tired from gripping it, it'll be hanging on to you. So you're not gonna let go.
Could I have used that when I had my cast?
Yeah.
You'd think that the doctor might have told me that.
Ask the nurse.
Yeah, ask the nurse. Okay, so on to the H and Thrive, healthy habits. Susan, we often hear that exercise is crucial for arthritis, but many people find arthritis find it difficult to get started. What are some of the beginner-friendly exercises that are safe for those living with arthritis?
First of all, get a friend that you can exercise with. Go for a walk. Do the simple things. You don't need to go jump into something crazy right away. If you start moving by yourself at home, that's the beginning stage. Then when you could start, you walk in your neighborhood, you walk around the block. And if you feel comfortable with that, come here. You can walk over here if you're in the neighborhood. If you're near the YMCA down here, either walk there, get a ride there. They have really great classes there. If you live in a senior facility, they have classes there. There's classes everywhere to just get you to try to move in the most simple ways. It doesn't need to be difficult, and we don't want you in pain. But movement, like I said, in those joints, there's a fluid, unless you have no fluid left. But even so, if you're still at the point where you still have some fluid, some movement in there that's not completely bone on bone, you want to keep moving that. And grab a friend. It's a lot more fun to go for a walk and talk with your buddy,
And last month we had Jessie here who was starting the Village in Seditas. And I was talking to her this last week, and one of the things they're talking about is starting like a walking club. But also it's a way to get to know other people that might have that same interest or lives closer to you to do it. So yeah, having that buddy makes a big difference for me. I don't do things very well exercising on my own, but if I have a friend, it's like I'm more likely to show up.
I got a personal trainer, because otherwise, if I have to pay someone, that's the only way I'm gonna go.
Yes, I've done that before with Chris in the back there. Thank you, Chris, you got me going. Okay, so Kim, in your experience, what are some of the key key nutrition tips for managing inflammation and supporting joint health? Are there any specific foods or supplements that help with arthritis symptoms?
Yeah, so this is one where I kind of default back to, I wish there was, a magic food to eat that cures everything, but there really isn't. The number one thing is going to be weight management. There are tons of studies that show just losing 8 pounds is going to take up to 5 pounds of pressure off your joints. So that's a big one. And again, there's no rocket science there, it's a balanced diet. Getting in those vegetables, getting in those fruits. There are some correlations, so one type of arthritis is gout. So that's where you wanna watch those, I always wanna call these prunes, and they're not, purines in the food that can cause a gout flare-up. So those are things that you find in seafood, in meat. So if you're experiencing gout, that is something you want to avoid. In the more autoimmune types of arthritis, so that's going to be your rheumatoid arthritis, we've seen great studies to adding fatty fish into your diet. That's really going to help as well to control those flare-ups. But again, there's not one specific thing that's going to cover everyone. It's really a healthy, balanced diet to support your joints, and ultimately supporting your joints is going to be conscientious of your weight and the pressure and the weight that's being put on those joints.
So one of the things I had always thought was like a Mediterranean diet, but in the Mediterranean diet, there's meat or maybe seafood. So it's like you have to kind of take things with where your body's at.
Absolutely. There's actually a study going on right now at UCSD that's specifically looking at the Mediterranean diet and how that affects autoimmune types of arthritis. And it's that inflammation. Right, so anything that the thought there is anything that we can remove, or if we can have a low inflammation diet, that is going to reduce your risk of flare-ups and then reduce your risk of developing specific forms of arthritis.
Yeah, go ahead.
I want to ask you a question.
Yeah.
I want to ask her a question, only because I've been learning more and more about some herbs and things. And I know we've started using turmeric quite a bit to decrease inflammation overall of the entire body. Have you, from the association, have they started agreeing that some of that use of some turmeric?
So I don't think we're at a point to endorse or say turmeric is, the one to do it. I do, however, completely agree that the studies are showing that anything we can do to control inflammation is really going to be that key, whether that's done through diet, supplements, specific foods, that is where the trends are going.
Yeah. It's kind of curious.
So Susan, how important is sleep for someone managing arthritis? And what tips can you provide to improve sleep quality despite being in chronic pain?
Sleep is everything. I know it's very difficult, and there's ways to try to help yourself get to sleep. Sleep is not only good to help replenish your blood system, which helps with the fluids in your body. Your body is made up of like almost 70% fluid, all up and everything. So those joints need to have that. So anything you can do to sleep, it calms your brain down. Everybody needs to, so like I work with a lot of neuro patients, and it's very important that you get your sleep so that your brain is functioning correctly in the morning. So then when you get up, you have good brain function, you're clear-headed, thinking about, okay, I'm clear-headed, I can go for a walk now, I can move. If you're not getting more than 6 hours of sleep, you need to talk to your doctor about implementing something else to help sleep, or even doing something simple as a hot bath before you go to bed. I'm one of those, I have the brain that goes 100 miles an hour, so I keep a piece of paper and a pen next to my bed, because sometimes you lay down and you start thinking of everything. And then you're afraid you're gonna forget about it the next morning. So write it all down, because once you write it down, it gets out of your head. And so these are just little tips to help make sure that you're getting a good night's sleep. Yes, I use melatonin quite a bit in a lot of my patients. There are certain ones I use that are, better than others, that are longer lasting. Talk to your doctor before you start any kind of OTC or medication, just to make sure it's correct with you. But the simple things, relaxation, yoga, calm music, whatever it is that works for you, try it before you go to bed. When you can get a better night's sleep, your health overall, we're gonna go back to a good diet, movement, water, and sleep.
Those are key. Yes. And we probably can't hear them enough.
Pretty much.
So for both of you, Kim, let's start with you. How has our understanding of arthritis and treatment evolved in the recent years?
Ooh, that's a great question. For me, I'm loving seeing more research being done on what we as the patient can do to control it versus the focus on medication. Not at all to say that that's not important, not at all to say that the research still isn't being done, but I love when we can really do things to control it ourselves. So the research of things like the Mediterranean diet, these low inflammation foods that can help us, for me, that's been really great to see. I think also our overall understanding again that this isn't something that we just have to live with. There are things that can be done to stop what you're feeling or even make you feel better. I think that's really great too. And then also there's in the last few years certainly been more openness to alternatives. So the things like aqua aerobics, the massage, acupuncture especially, you're going to now a traditional rheumatologist and they're talking about those things. It's not just here, take this pill. It is, okay, let's try this, but in conjunction with that, here are things you can do. And I think that's so powerful, even just mentally, to know that, hey, I'm engaging, I'm doing something that's going to help my body other than taking a pill, which again, not to say that that's not important, but there are so many other things we can do to support our bodies outside of that. And that's been really great to see.
Susan, do you have anything to add?
I'm just gonna agree with her on that because the fact that medicine overall has been changing over the years. So honestly, we're getting more information now. So you're more educated now than what we were 20 years ago. And so a lot of American medical doctors are now starting to look outside of American medicine, looking to Chinese medicine, looking to herbs, looking to different modalities to help. Because the main thing is each and every body is different in how you're gonna, respond to a medication, to a treatment. It's you are an individual. And so finding the right dose, the right key, the right whatever it is for you is the most important. So we keep looking towards technology to educate us as educators to educate you.
And one of the things that I used to go to an acupuncturist, which helped a lot, but he is bringing in new technology and using the infrared, and it really helped me. So it's the combination of, the older Eastern medicine bringing in the new modern devices and techniques. So let's go on to the R in Thrive, which is about relationships. So Susan, how can loved ones and caregivers best support someone with arthritis while respecting their independence and limitations? And before I have you go on that, I wrote down caregivers, but I've been going to a support group for Alzheimer's, and they say to call it care partners instead of caregivers. But anyway, do you want me to repeat that again? Okay, you got it.
No, I got it. I actually work with quite a few, we call them private caregivers. So a lot of the ones that I help families bring into their home to help manage their health and safety at home. I educate them on a regular basis to make sure they're providing the care that is needed. And so my thought, my teaching is let the caregiver or let your family member, if you're living with a family member and they're trying to say, oh no, let me do this, I don't want you to hurt yourself. No, that's not it. You need to move. So if you need to move, we want you all to be able to live a long, active life. So you need to continue with your ADLs, activities of daily living. And it's super important. So if someone takes away the dishes and says, oh, you can't do the dishes, that it's gonna hurt you. No. You are independent, you're strong. If it's something that's dangerous, Yes, let them help you. But we want you to maintain your independence as long as possible. Family and caregivers, they can come be there. We call it standby assist. So there's that extra set of eyes on you to make sure you are safe, but they don't need to be taking things away from you when you need to move and do things. But make sure it's a safe way that you're bending over, you're moving, all those activities. But yeah, keep an open, have an open conversation with your family and the caregivers. Even like housekeepers, if they're, doing too much, ask them, say, hey, can you leave the towels in the dryer and I'll get them and I'll fold them, because that's good that's good occupational therapy for your hands to be able to fold the towels. Simple things like that. So don't give up. Just keep going. Just keep living you. I mean, you've been doing it this long. Keep it up.
Yeah, that's really good advice, because I think too, as caregivers, we often try to save the person and instead of really helping them and letting them do those things. Susan, another question. Arthritis can sometimes lead to feelings of isolation. What are some strategies for staying socially connected while managing the physical limitations of the disease?
Well, you all got here, didn't you? So, again, it's being open with family and friends. It's okay to talk about arthritis, or you're a little slower today, or, it may be hard at first to talk about that, but the more you open up with other people, you'll find that the person next to you probably has the same thing, and maybe they need a friend to talk to. Getting out, and like I said, coming here to this, make sure you're getting out and doing something. There we go again. Get out and walk. Get out and move. And if you're shy, you can sit in the back of the room. That's okay. As long as you're, getting out and doing something. Find a friend. If you're a little more shy with a friend, ask your family member. Say, hey, I'm feeling kind of quiet today. My arthritis is acting up. Would you take me over to the park just so I can get some calmness in my head? And it's okay to talk about this, and it's not embarrassing, it's not unusual at all. This is so very normal. And, pain is difficult to live with. And until someone's been in your shoes, they don't understand it. So the more you talk to them and explain it to them, the better they're gonna listen and be there for you.
So I don't know about a lot of you, but I know I tend to suffer in silence. Like, I don't want to talk about it. It makes it feel more real. And, so my friends are always like, Christy, you have to talk about it. And so being curious about other people and getting them to talk about it's probably really good.
Because I guarantee you somebody else is in pain. If it's not arthritis, it's something else, and they're gonna wanna share their pain with you.
Okay, one more question, Susan. How do you recommend navigating social situations like family gatherings or events when pain or fatigue might make participation really kind of challenging?
Okay, let's see, we have Easter coming up as the next big family holiday coming up. If you find out, let's say, a couple days before Easter, and you've already promised that you would make a pie, do you think you need to push yourself, or do you need to pace yourself? So your family's gonna understand. They love you. Don't worry about it. It's one of those things, again, open up to them, explain to them, hey, I'm having a flare-up today, it's a little tougher. Can I just buy a pie? Can I order it in? Is there something else I can do? I'll bring flowers instead because I can pick those up, or pre-made rolls, things like that. You don't have to be Superman, Superwoman. Goes back to the pace yourself and being honest with the family, because the family doesn't want you to push yourself either. Because if you've ever done it, you go to their house and then you're feeling weak. We don't need you to trip and fall at your kid's home. They're not set up like some of our safer homes. So things like that. Just take your time, pace yourself.
So I'm moving on to the I in Thrive, which is inner well-being. So Kim, mental health can play a significant role in managing arthritis. How do you recommend addressing the emotional and psychological impact of living with chronic conditions like arthritis?
Yeah, we've kind of heard about it a few times, but I think it's honoring and vocalizing how you're feeling, what you're experiencing. We heard this quite a bit at the Arthritis Foundation, particularly when COVID became a thing. So what we have at Arthritis Foundation is we have what we call connect groups. So those are groups based on subject. So some of those subjects are based on your arthritic diagnosis, so rheumatoid arthritis, osteoarthritis, gout. But then we also have groups based on affinity. So that might be, we have one for young women who are family planning. So that focuses on what are things you can do to support that, what are medications to avoid or to go on. And we found that that's a really, really great and safe way for people to connect with others so they don't feel so isolated. Yes, it's over Zoom, but when you're getting on that Zoom meeting and there's 60 other people there who can, really know exactly what you're experiencing and has been through something similar and kind of, we say deal the tricks of the trade to make life easier, that's a really great way to connect. That also is a very safe way to connect. You're not having to go out, you're not having to be in a room of 60 people, but yet you can still open up, you can still build connections there, so you don't have to feel so isolated. I think that's a big one. And also recognizing that that is a component, mental health is a component of an arthritis diagnosis. So it's not something we want to ignore. It's not something that you want to wait until you're feeling incredibly isolated and in a dark place to then start talking about it. We want this to be same as, diet and exercise and it being a consistent thing. A focus on mental health should be a part of your arthritis plan and supporting your diagnosis.
So I know a lot of you don't have a computer, but for those of you that do, on the back side, Kim gave me a link to go and connect. And if you're having a difficulty with that, reach out to us and I'll give you the link that you can just click on instead of trying to type it in. Okay, so the next one, Susan. For someone dealing with stress related to their arthritis diagnosis, what mindfulness or relaxation techniques do you recommend for managing stress effectively?
Yeah, we kind of went over some of those already. One of the things besides using Connect is also journaling your feelings and then also reaching out to a therapist. Psychotherapy is really great because sometimes you don't want, if you really don't want to share with your friends or talk to about it, find a therapist that you can talk to. You go to their office, it's quiet, there's nobody there, you can talk about your pain, you can talk about how maybe, your brother-in-law is not the nicest to you and it creates more pain because you get more stressed out, whatever it is. And that helps with stress. The other things are, like I said, to try and to sleep, a yoga, a soft stretch, quiet music, a hot bath, going to a park. Some of the parks have ponds, and if you listen to the waterfalls or the fountains are really good for therapy to just kind of sit and spend your time in your own head to listen to the water dribbling and the sound of that. As a kid, and I still do it nowadays, my husband thinks I'm crazy, but when it's warm outside, lay down on the grass, make sure you get back up, but lay down on the grass and look at the clouds that go by and see how many shapes that you can pick out in the clouds and just how relaxing it is to watch the clouds go by. There's nobody there to bother you. But like I said, just make sure you can get back up.
So that's something we used to do as kids, and it's like, okay, or not now, as adults.
You can do it now.
We could actually sit in the chair
Yeah.
and go up. So one of the things that helps me is playing with my dog. It's like when I get stressed or am hurting, it takes my mind off of it. It's just like, and my dog Garrett is always happy, and thrilled.
They're therapy animals.
Yes. Okay, this one can be for either.
Can I just
Yes,
add real
please,
quick?
yeah.
So oftentimes, Arthritis Foundation staff, we are kind of the guinea pigs. So we'll test things out before we start telling the community about it. It's an app that the Arthritis Foundation staff has started to use, but we've found it really great, it's called the Calm app. So CALM, Yep, and that has on there guided meditations of all different lengths. It also just has soothing music. It's a free app. It's really great, but for those more techie ones, that's been a wonderful resource that we've been telling people about as well.
Yeah. That one actually works for sleep too. When I used to work the night shift, I'd have to sleep during the day. So you can put the Calm app on certain sounds, whether it's a rain sound, whether there's an airplane sound, all kinds of things, the different sounds that can help you relax or fall asleep. It's CALM. It's an app. It's free. It's another good one.
Meditation helps me a lot. In fact, this morning, always before I do the seminar, I get a little anxious and nervous, and so I take 15 minutes or longer and meditate for a while and just kind of, okay, everything's gonna be okay. So, yeah, I really think that's a great thing to do.
Everything's gonna be very good.
Yes. It's a good mantra to repeat over and over. Okay, how can someone with arthritis maintain a positive mindset, especially during the flare-ups when the symptoms are particularly hard to manage? We kind of touched on that. Do you have any more to add to that?
I think that's when those support systems really kick in the most. Those people you've met in connect groups where you can send a text, you can send a call, let them know, today's a bad day. I think that's where you want those relationships already in place. You want those strategies already in place before you're experiencing that.
Do you have anything more to add, Susan?
We've hit on it.
Yeah, okay, good. So on to the B of Thrive is valued activities and hobbies. Susan, how can individuals with arthritis continue to pursue hobbies and passions even if their symptoms make physical activity more challenging?
That's gonna end up being a lot of mental more than physical, believe it or not. You think about those that are, in wheelchairs, paraplegics, people who have real, serious disabilities, how do they get around it? A lot of it's mental. And you have to put yourself in that mindset of, yes, I can do it. So maybe today, if I'm a little slower, that's okay. We're gonna pace yourself. And you're gonna start with, something relaxing, easygoing, and just, can I stop for a second? I love you back there. You are the best. She's up and walking. And sometimes that's the best when sorry to embarrass you, but that is that important, you guys. Don't say no to things. You don't ever want to say no. When you stop, your body will stop. So keep it going. So what's your favorite thing to do? Do it. Don't be afraid of it. If it's gonna hurt that day, take your time. But it just, take the medication maybe that day, ask the doctor, do I need to up my dosage? Because it's getting harder and harder. My joints are stiffer and stiffer. My feet are so, with the gout, they get painful. Instead of sitting there and wallowing over it, no, get a mindset. It's gonna be a good day and you're gonna be able to do it. Don't give up.
Well, and one of the things that you just pointed out as far as movement, Rick and I went on an appointment together, and the lady was in a lot of pain. And she had one of the walkers that you stand up and walk. And so it's like, feel free, don't sit here in pain if you have to get up and walk. So, it's like we were sitting there, but she would walk in her walker so that she could stay out of pain. So, yeah, it's just being mindful enough that you're suffering and get up and make that change.
And move, yeah.
Yeah.
It makes all the difference.
So Kim, what are some adaptive strategies or tools that can help individuals continue engaging in hobbies or physical activities they love, such as gardening, painting, or dancing?
I think ultimately it's you want to have as many tools in your toolbox as you can. So yes, your rheumatologist, your family medicine doctor, that's going to be a tool in your toolbox. That medication they're providing you is going to be a tool in your toolbox. But so is your diet. So is the exercises and the stretching that your physical therapist has shown you. So is wearing the supports and the guards that your occupational therapist gave you. So all of those things are going to allow you to continue to do your hobbies. And then it's also, like you said, not giving up. It's the mental game of it, which, not to discredit that at all, that is just as difficult as the physical side of it. But it's recognizing that things may be done a little different. So for all of us pickleballers out there, a few years ago, you may have been playing 5 days a week. Well, when you start experiencing pain, that doesn't mean pickleball needs to stop. Maybe it gets down to 2 or 3 days a week. Or maybe you've found through our Connect groups that coldness is a common symptom that causes flares for people. So maybe you keep that in mind, and our pickleball is saved for the summer instead of the dead of winter. So little things like that. Again, it's knowledge, it's having a robust toolbox, from the littlest things of knowing the information in our pamphlets to, consulting with specialists and doctors who can give you very specific advice. You want it to be well-rounded, so you feel as in control as you can for something that's not always controllable.
And I think of myself, I love gardening. I love it, but over the years it's been getting more difficult. And you would just take a whole weekend and go out there, weed and plant my new plants, and we have compost you put in there. So I'm depending a lot more on my gardener to do the things. But I've also, on our kitchen countertop, start seedlings. So instead of buying the plants, I do a little gardening on the kitchen countertop. When Rick does, cuts up the bell pepper, I take those seeds and plant them and actually get little. So it's like finding ways to still enjoy it, but get help to be able to do it. So how do we stay involved in those valuable activities and help with overall mental health and motivation when managing arthritis? I think we kind of touched on that. Do either of you have anything more to say on that part?
No, basically it's like I said, find a friend. It's a lot easier with a friend, whatever activity is you want to do. Go to, get online, see if there's someone else that wants to go join and go for a walk or do something. It's always nicer when there's someone else there.
Well, and I think about going to Connect or trying different things, because it's like we've all had hobbies. I looked at my mom, she used to love knitting, and her hands got so bad she couldn't do that anymore. So she started doing more puzzles and started, it's like, so find the hobbies that you can do. But, a lot of us are so stuck in doing one thing instead of looking out, what else can I do? What else might I have an interest in? Instead of just going, I can't do that anymore. Yeah. So the last is E in Thrive, for executive functions. So Kim, what are some of the best practices for taking charge of your care team, particularly for someone newly diagnosed with arthritis?
I think first and foremost, it's recognizing you were in the driver's seat. Yes, you are going to be taking a lot of information from others, highly skilled, highly educated individuals. But at the end of the day, it is your body and it's your symptoms that are affecting you. So I think keeping in mind that you are in control, you set the pace, You don't have to say yes to everything if something doesn't feel right, is very important. Good or bad, the reality is here in San Diego, if you are trying to see a rheumatologist, you are on average going to wait about 6 months to get that first appointment to see that rheumatologist. And the reality is oftentimes during that first visit, you are not getting a diagnosis. You are not getting the perfect medication for you and what you're experiencing. So again, that's where it goes back to those 6 months. Let's get you tools so you can help yourself. Another really powerful thing that I find is because people with arthritis are just so used to living in pain, sometimes we don't recognize how not normal that is. Just because it's become normal to you doesn't mean that that's something that you should live with. So oftentimes writing down symptoms will help as well. Also writing down if you're seeing commonalities in when you're experiencing flare-ups. For example, it's in the morning or it's after you went to your Sunday seafood boil, whatever that is, to help the doctors, because again, they're gonna see you for such a short period of time that we as the patient have to give them as much information as we can. So that's where writing things down really helps. And also recognizing that when you're in that appointment, you control the information that's given. You want to give as much as possible so that we can hopefully not have to wait another 6 months before that next appointment to try a new medication or try a new strategy. So definitely writing things down, having tools in your toolbox, and then following up. Nowadays, oftentimes you can message your doctors online, you can email them. If you're not experiencing feeling better in a timely fashion, again, we don't have to live like that. You know, you don't have to wait for that next appointment. Bug them, send the emails, make the calls. Don't just accept that you are in pain and having to say no to things. If you find yourself saying no to your activities, that's gonna be a real quick good sign that it's time to go see a doctor.
So one of the things that you mentioned as far as writing things down, it dawned on me how much better my husband is at writing things down. He has like a journal that he keeps of, it's like when he's working out, what hurt and what didn't. I'll jot it down and go, oh yeah, I'm gonna give that to the doctor, and then once I see the doctor, if I remember to bring it, and then I toss it, instead of being able to go back and say, oh yeah, that happened before. So having like a pain journal or an activity journal, that would be helpful, it sounds like.
Absolutely, and also don't forget, the same as those contact, the email and all, that can be used post-appointment, it can also be used pre-appointment. So, maybe you wanna send those things that you're experiencing to your doctor ahead of time. That can be done too. So it doesn't just have to be reflective, it can also help in preparation for doctor's appointments as well.
So I never thought of that, so like I belong to Scripps, I have the My Scripps portal. Would I just go in there and like message my doctor and say, remind me to talk to you about this the next time I'm there?
Yep, can you add this to my chart? Oftentimes it's nurses who are reading those messages. So, hey, in preparation for my appointment, just wanna make sure that the doctor's aware that, hey, I'm experiencing pain most in the morning. I experience pain most after I'm having repetitive movements. Or, hey, I've got a lot of shoulder pain, but nothing's ever happened to my shoulder. That right there cuts down 5 minutes of your appointment of the doctor going, okay, so tell me about, have you had repetitive movements, any injuries to your shoulder? That right there starts the conversation, and then you're maximizing that appointment time that you've waited so long to get.
That's really a good idea. Susan, what role do healthcare professionals like rheumatologists, physical therapists, dietitians play in helping someone thrive with arthritis, and how can patients best communicate those needs?
Well, she got my
Yeah.
line. No, I'm glad you brought it up because I was gonna bring it up too. Another thing that works really good, before you see any of these doctors, first of all, your primary care physician should be an internal medicine doctor at this point, or a geriatrician. They're the ones that have the most knowledge as we grow old. And then from there, you have your specialists. And you want to be able to, if you're techie and you're online, and you can go to My Scripts, kp.org, all of them, great, get on there, do like you said, write it down there. If you're not techie, I do this with families that I bring caregivers in, so then the private caregivers keep a log of every day what goes on. You can do the same thing if you just want to write down, you keep a medical log, so you have a little book and you write medical log. And have it big enough so it's like a folder. So you'll get all these papers that come in from the hospital visit, doctor visit, things like that, that you can put in this folder also. So you have blank pages, so you can write stuff ahead of time so you don't forget. When you're there at the appointment, you can go over it again and make notes. And then that way you're making notes. And then you get all the paperwork, the after work stuff, all goes in there too. So you have one spot for all your medical stuff. If this starts to get too much for you, bring a family member, a friend, a caregiver, case managers, things like that, people that can help understand some of the jargon or some of the stuff that you may not know and understand. Or ask the doctor, after the doctor leaves, ask your nurse. Say, do you mind, wait a second, can you talk to me about, I didn't understand when he said this word. And the nurses they'll talk to you, they'll tell you about it. And they'll probably say, oh, I've got a brochure from the association on it, let me hand this to you. And then you put it in your folder again to continue that, keep going forward. And that way, every doctor you go to, you have your folder that has all this information in it, so that no matter if you're going to the rheumatologist, your internal medicine doctor, your cardiologist, you have everything in one spot. So then, excuse me, so that you can talk to the same stuff, to the same, to all the different doctors. Because a lot of these doctors, they don't talk to each other. So you want to make sure you're the smart one that's going to involve all of them. Because sometimes if you slow down in movement, maybe it's not arthritis that's slowing you down. Maybe it's the lungs are getting harder to breathe and that's why you're slowing down. A lot of these things can all be talked to your internal medicine doctor, your geriatric doctor. Talk to them about all these different things. And then the specialist will take care of each special part of your body that's maybe having one issue or another.
So Susan, one of the things that I'm thinking this is what you do is, so like I've gone to my family doctor forever. At what point do you go to like a rheumatologist or gerontologist? It's like, and do you help guide? Like, do you ask the doctor, can I go here, or how do you go about that? I think that's kind of what you do, right?
Yeah. I can go with you to the physician, whichever doctor. So if you want a nurse to come with you, I can come with you. We'll sit and I'll, speak to you about your past history, and so I have a little bit of knowledge before I go into the doctor's appointment. We could discuss this, and then that way, whatever your needs are going forward, I can help manage it. As long as patients give me permission through HIPAA to be able to speak with the doctor, and the doctor and nurses are able to speak with me. I actually get online and I get right on My Scripts or any of those, and I do I can help change medications, I can help, those appointments that you can't get into, I might be able to get you in a little quicker because I have a little edge. There's a few terms I may use to the doctors that make them more aware, oops, maybe I should try and get this person in sooner, certain things like that. So it's a whole process, and each doctor is specific to whatever it is. So you start with your internal medicine doctor. They're the whole body. They work more with the aging ages, You're not going to a pediatric doctor, you're not going to a general anymore. You want the internal medicine doctor. They're gonna work with the whole body. Then when it comes very specific, if it's arthritis, you go to a rheumatologist. And they specifically work on that area. They're not gonna help you if for some reason your blood pressure is either going sky high or really low. That's not what you can go back to your internal medicine doctor, but he may go, well, okay, this is beyond me. You need to see a cardiologist. So sometimes the specialists are really important depending upon what's going on your body. But like I said, you or your person that's going with you will have to help get all these doctors to understand these are all the things that are going on in your body. Because most of the time, we've got like 4 or 5 things that are all going on in different parts of our body, and not all these doctors connect. So unless you get in there and you stand up for yourself, you have someone to advocate for you. It's important because your body is your body and you're in control of it. We've said that over and over again, it's important, So take control of your health and get to the doctor. And if you have to call back, if they say you can't see a doctor in 6 months, call back the next month. Call back the next month. Doesn't matter. Don't feel like you're bugging somebody because your health is more important. Trust me, because there are people that walk into the emergency room with a cold. And that's because they want attention and they want it now. So don't forget, you are that important, but please don't go to the ER for a cold.
I had a colleague one time who I think gave a great analogy, and it was, you are the team captain, and all of these specialists are going to come in to fill positions on your team to ultimately help you win as the team captain. And I think that's really great and goes back to what you were saying, that all of these different specialists are gonna play positions on your team, but they're not all going to talk to each other. And you as the team captain are ultimately the ones that are going to be giving the direction, going to be deciding what plays are made and all of that. So I think that's very important to keep in mind.
So it's interesting because the next question, we may have just answered it, but you guys might have something more to add. Is how can someone with arthritis balance managing their health, work, daily life responsibility without feeling overwhelmed? It's a lot.
Yeah, pacing, and it goes back to recognizing that it is a lot, and that's okay. You might not be doing everything you did before now when you're experiencing these symptoms, and that's okay. It's getting new tools in the toolbox. You may not be somebody who's ever done acupuncture before, but let's try it now. So I think that's, yeah.
Getting an advocate, getting a case manager to help you guide through all of this so that you can help understand. The medical world is very confusing. We have a lot of stuff that changes. That's why we're talking about, the future. It's just, we find out more. Every year there's a new something or other, new medication that I have to remember all these things, both names. So there's always something that's new, and it's okay if you're overwhelmed. Let's get help. Let's find out who can be your advocate with you. If it's family, friend, a professional, don't get overwhelmed because there's help for you.
So wrapping it up, are there any new technologies or something that we didn't touch on that you wish that we would have before we do questions and answers?
Not for me.
No, I think you and I even talked about stuff.
You guys did a great job.
So-
Didn't they do a great job? So what we're going to do now is raise your hand if you have a question, and they're going to bring, we have lots of questions. They're going to bring a microphone to you.
Okay, this one has a green light.
That's good.
I'm Lois, and I recently saw an advertisement about things that would help arthritis, and it said eating small amounts several times a day is better than 3 meals. Now, why is that? And how are special diets now, gluten-free, vegan, and so on, affecting arthritis?
So I will be honest, I've not heard the small meals or better than larger meals, so not sure about that one. As far as diets, really the study there and the insight there is we want to put things in our body that's not going to cause inflammation. So when you hear about gluten, oftentimes that causes inflammation in people. So it's really keeping those inflammatory foods down to a minimum. And that is all both reducing the risk of developing things like RA, but then also slowing down the progression of it as well. And when we get those anti-inflammatory foods into our diet, reduce the inflammation, ultimately that's going to reduce pain.
Okay, I can answer on the 3 meal thing, or 3 meals as opposed to smaller, more meals. That has to do with your blood sugars, because if you continue to keep your blood sugars all more at an even keel, it's actually better, because if you're pre-diabetic diabetes, the too much sugar in your diet will start to cause pain in all of your joints. So that's why it's a matter of keeping your blood sugars at a level. It's also better to for your digestion, so you can actually it increases your blood, your digestion, so that it all plays even. So you don't have spikes in your and that's what that's all. But and what you said is same thing.
Okay, Chris?
Hi, I'm Doreen. My question is, I need to switch doctors because Scripps is no longer taking Medicare. And before I go to get my new doctor, what I want to know is they say that as you progress, you should not just see your regular doctor. There's a name for doctors who treat elderly patients. So can you tell me what that is, pretty please?
Yes. There again, that's an internal medicine doctor or a geriatrician. I know about the Scripps. It's been real hard for a lot of people. So whatever your insurance is, if it's just straight Medicare AB, that's fine. You can look up through them to look up doctors that you can go to. There are still some, so like if you live here by Scripps Hospital here, there are still doctors that are not Scripps doctors and they're around here. So don't be afraid to go through your insurance and ask first. Look for an internal medicine doctor or geriatrician. Those are the first one that you need to see. They will do that's your primary care physician that will take care of all the basics. And it may take some while to get in, but there's some great ones out there still.
My name is Eileen. I'm just curious, what tests does a physician usually recommend to see whether you have arthritis?
Yeah, so there's gonna be, usually it's about 4 different tests. So they're gonna do a physical exam, have you move your joint, indicate where it hurts. There's also blood tests that are done and urine tests. The urine tests are more gonna be looking for the raise in different acids if they're suspecting something like gout. And then there is also imaging that can be done. So that can be an MRI, an X-ray to actually see the extent of the damage on a joint. And that's going to help in cases like osteoarthritis to see, are we having bone on bone issues here? How much cartilage and fluid is left? And then that will help them with prognosis and kind of aftercare. What does that look like? Are you at a point of surgery yet? Or can we still keep preventative medicine going and hope that we just slow this down?
Hi, I'm Catherine. I once worked for a very busy clinic, and it's important to know with these waiting lists that the polite, squeaky wheel is more likely to get the grease. A clinician just cannot possibly see everyone, but if there's someone that looks like they're going to really work with you and they're taking things seriously, etc., there's no promise, but you're more likely to get seen. Probably the best advice I ever gave anybody.
Hi, my name is Judy, and I understand that melatonin can have some bad side effects. What is that all about?
That is something you can discuss with your physician. It depends. Melatonin that are out there, most of them are not regulated. There are a couple companies that are more regulated, but work with your physician or your pharmacist. Your pharmacist is going to be key on that. I love pharmacists because sometimes our doctors don't have every medicine you've ever taken.
Hi, my name is Carl, and this question is for Susan. As you were talking along at the beginning of your presentation, you talked about arthritis and so on, and you said ice could work well with it. You didn't say anything about heat.
It depends on where you're at. It depends on if you're trying to treat the inflammation or if you're trying to treat more some of the pain. Not too hot, you can't have it too hot because it'll irritate it again. So we use physical therapists, occupational therapists, work with hot and cold, depending upon what the actual, what you're trying to treat.
Hi, my name is Susie. How do you know what kind you have and does it even matter?
Yes, so it absolutely matters. It's gonna matter for a treatment plan. And, sorry, what was the first part of your?
How do you know what kind you have?
Oh, so the question was, how do you know what kind you have? And that's gonna be done with your doctor through those different testing. So, osteoarthritis, again, that's gonna be bone on bone, that is not an autoimmune issue. So that is going to be differentiated in blood and the symptoms that you're experiencing. But yes, it absolutely matters what kind, although there's commonality between, how heat and cold are gonna help multiple things, but as far as medication, long-term effects, all of that, it absolutely matters.
What kind of tests do they do, like blood tests or?
So there's blood tests that they're gonna do, there's urine tests that they're gonna do. There's also going to be different imaging that's done, again, depending on what the doctor feels is best, whether that's an X-ray, an MRI, to determine what exactly do your joints look like, what stage are you at. Again, kind of going back to the beginning, not everything equals surgery, not everything equals a joint replacement. There are many other medical combination of things that can work to avoid surgery. That surgery is always going to be a last resort.
Other questions?
Christy,
Oh, I'm sorry.
I think it was you that mentioned a website but you didn't get it to ever.
So if you look on the back side, I think I put it there.
It's there.
Is it there? Yeah.
No, I don't see it.
Yeah, it's our Connect groups. So it's our website's arthritis.org. I also have business cards on the table. So if you want to send me an email or give me a phone call, I'm happy to follow up individually with you and send you any links or talk you through how to get there.
Okay, just one of the websites.
Yeah, I think it's on the action step.
Oh, okay, she showed me.
Okay,
Thank
good.
you.
If anyone else needs to find it or wants to be connected, Kim will gladly help. I think there was one other, couple more people over here. So we'll take two more people, and then we'll wrap it up, and I have a couple more announcements then.
My name's Eileen, and I wanted to know at what stage do you determine joint replacement, if that's something that you can answer? I mean, does it have to be really severe, or is it a question of just limitations, or when you've tried most of the avenues that you've discussed, how do you determine what is the time for a joint replacement?
Ultimately, that's going to be a decision between you and your physician, and it's weighing pros and cons. Surgery is surgery. It's not easy. So it's ultimately weighing the rewards and the benefits there. But that's going to be a decision between you, your doctor, and your support staff there.
And